And at the end of the discussion, most of the families will ask, but apart from it, everything is okay, right?
How do I use it? That's where the human intelligence comes in.
Because we are playing with human emotions. I don't think AI is ever going to replace the doctors. Right.
AI doesn't have greed or fear.
Right. And something goes wrong. Who is going to be accountable for it? Robot doesn't have emotions. One error is going to cost the patients their lives.
The world of investing and personal finance is more about personal, less about finance.
You, if a robot agrees to operate on you, would you?
Never. Hey, hi Dr. Suril.
Hi Krish, how are
What are you
you?
doing here in Financial District?
Yeah, I like to come here, and meet
Where are your
people.
robots, man?
Yeah, I carry them in my pockets all the time. Yeah.
Oh,
Can you
seriously?
see them?
I thought you're always busy doing robotic surgery with your robots and saving the world and your patients.
Come on, man. I mean, I like coming here and meeting people like you and getting some financial advices how to manage my money.
So seriously?
Yeah.
That calls for a conversation then.
Oh, absolutely, I would love to have.
So let's try to find a place and then talk about some interesting things.
Yeah. So we're talking about robots. What do you really think I do with robots?
Oh, I know a lot about robots.
Like
I've seen that Arnold movie a dozen times.
which movie? Which Arnold movie?
Terminator. Jokes apart, but what I know is that robots nowadays help in surgeries,
Right.
and lesser mortals like me feel that someday probably robots will replace doctors like
Replace
you.
the doctors.
I don't know. whether-
So let me clarify.
Okay.
Robots don't help me in surgery.
Oh,
They are the tool for me to do the surgery. So the robot that I use, it has 4 arms. So
Okay.
one arm is showing me the camera.
okay.
The other 3 arms are having the instruments with
Nice.
which I operate.
Okay.
Right, and I operate it from a distance but it is inside the operation theater only. So those hands, they go inside the patient's body through tiny holes, like 8 mm holes.
Okay.
Right, and those arms are being controlled by me, and I do the surgery with those arms.
Okay.
And those arms are like super versatile and extremely precise instruments. So it moves like my wrist inside the patient's body, right? So there are places where I cannot even reach with my hand,
Right.
right? So the camera is going to reach there and the arms are going to go there. And then whenever I'm holding an instrument, so even if an open surgery, if I'm holding an instrument, so the instrument is in my hand, my wrist is moving. So along with my wrist, the instrument is moving, but it is a straight line. It's a shaft, right? So, but it has got no movement at the terminal end.
Okay.
Right. So if this is an instrument, so this can move here, but this part doesn't move in an open surgery. So robot goes there, and this part is moving.
So it's
right?
far
So-
more versatile than the human hand.
Exactly. So the vision, the dexterity, and the versatility combined with the 3D image. So the robot really shows me the 3D image, which we see in the real world. Like on TV, you see a 2D image, so there is no depth perception, right? So robot has eyes exactly like our human eyes. So they will combine the 2 images that the eyes of the robot has, and then they combine it into one, and I feel like I'm sitting inside the patient's tummy and operating it. So that is robot, right? but it is never going to replace me. So far there are. I mean, I don't see any evidences where there will be an autonomous robot just with हमने patient पे छोड़ दिया और वो surgery कर लिया उसने. ऐसा I don't think there is anything coming up in near future. Of course, it is collecting the data, but the data is going to be used for the betterment of the surgeries to aid us in the surgeries rather than becoming an autonomous surgeon.
So it's essentially going to augment
Exactly.
the surgical process.
Correct. Correct.
and not essentially replace
Replace
the
the
human
surgeons. Yeah,
intelligence
yeah.
and angle involved to it,
So
right?
would you, if a robot agrees to operate on you, would you?
Never. I think I'll trust a doctor more
More than a
than
robot, right?
machine. Yeah. So I had always thought that there are great parallels between surgery and investing.
Really?
Oh yes.
How come? That is a very new point of view that I'm going to hear now.
See, I think what you do and what I do,
Mm.
risk and risk assessment remains the core of it,
Yeah, that is true.
right?
That is true. So we usually see the patient, and first what we do is to stratify the risk of this patient who is to undergo a certain kind of surgery. That is very true.
Yeah. So same way, if I'm talking to a prospect,
Mm-hmm.
the first thing that we'll do is we'll look at age profile, we'll look at current financial status,
Okay.
existing portfolio,
Okay.
then future objectives,
Right.
and then decide on what kind of asset allocation
That you are
would
going
be
to have.
ideal or optimum for him or her.
Yeah.
Same way, a young prospect can take more risks, so I can suggest him, depending on investment objectives, a mid-cap fund,
Right.
a small-cap fund, or
Right.
probably a mid-cap stock as well.
Right.
If someone is of elder age
Right.
and preservation is the first goal,
Right.
then obviously the approach becomes different,
Hmm.
which would be
True.
same
So-
for you as well, right?
Yeah. So it's like I cannot use a knife where a simple suture can do.
Absolutely.
So in your analogy, if we see, so you cannot, what you're saying is you cannot ask a 70-year-old guy to catch a high flying stock,
Absolutely.
right, and then lose 50% of his wealth. But you can do the same thing with a 30-year-old guy who has more life and who is still in his you know
Who's into his prime years,
Correct, prime
and,
years.
and has enough time on hand
Correct.
to recover from that volatility,
From the
which a 70-year-old is less likely to.
Correct. Right. So talking about the similarities between investing and surgery, do you know what is one thing that makes it not so similar?
Oh, really? I thought they have similarities and there is no distinction as such.
Yeah, they have similarities, but there's just one thing that I would say is kind of different, is the amount of expectations that people have from an investment advisor or a portfolio manager and the surgeon. Right?
Interesting.
Right.
Yeah.
So I'll give you one scenario. Suppose there is a patient who is very sick. Maybe suppose to say, for example, he's bleeding internally, right? And the family finds out that there is something wrong with the patient, and they bring him to the ER, right? I see the patient in the ER. The patient might be a very elderly gentleman or a lady, very fragile, heart not working properly, maybe had a couple of heart attacks in the past and has a couple of stents inside the coronaries.
So
right?
all kinds of
Complications. Problems, right? On multiple drugs already, on the medication that makes the blood thin, right? So more prone to bleeding internally, right? And such a patient, when they come to the ER, what the patient's family and the patient themselves, what do they expect? They expect that once we are in the hospital, the patient is going to be all right.
True.
Right? But they don't understand the gravity of the situation at that time. You are in an emergency situation. Otherwise, you would have come to my OPD,
Right.
If the patient was stable. And once we counsel them, when we explain them what is going on, once we find it out actually what is going on, we explain them. We summarize everything by drawing figures and making them understand that the entire anatomy, physiology, what is going on, right? At the end of the discussion, of maybe that discussion lasts for about half an hour, 45 minutes, and at the end of the discussion, most of the families will ask, but apart from it, everything is okay, right?
Right.
So it is not their fault. It is never their fault. It is the basic human nature to think that we are okay, we are
Absolutely.
fine, and we
Absolutely.
will be fine, right? I think that is the most important thing that we have to handle as doctors,
Absolutely.
right? Because we are playing with human emotions, and we have to take care of human emotions. We have to take care of the human anatomy. We have to take care of the human physiology, and we have to take care of the expectations of everybody. Then, considering everything, we have to do our job, and in that pressure, we still have to deliver the best.
True. I think managing such expectations and then delivering on it under
Correct.
that high stress environment,
Correct.
I
Correct.
think is,
And
is unique. Means enough. I think
correct.
other professions can't simply have.
Correct, because we deal with life,
True.
right? I would, I mean, obviously, if you also make a big mistake and the family's wealth gets ruined, right? But that will still not be equal to losing a member of the
Yeah,
family.
you can always earn back
Earn back the money.
the lost money,
Correct, correct.
or the reduced portfolio value.
Correct.
I think
Correct.
life
the,
is
the life is not.
life is
We cannot bring it
yeah,
back.
means we can't
And super smart guy like you, I don't think you will be at any point of time you'll make any decision which will make them lose more than 10 to 20% of the entire portfolio wealth. Right?
absolutely like
So
I recall, I think there is some principle in medicine or surgery which
Right.
says primum non nocere.
Correct.
Right?
Do no
first,
harm. Yeah.
first do no harm.
Correct.
So we are also guided by that principle that
Correct.
first we have to protect the downside.
Correct.
However, now I understand after these last 10 minutes of conversation that the kind of risk and expectations you manage and then you deliver in the kind of high stress environment is drastically different from what we do. So this is simply distinct than
Yeah.
what it is in investing.
Right. So that was one thing I wanted to talk about. Which is
Enlightened.
different. Yeah.
No, enlightened today. So, as you also know, AI is the buzzword these days. It's getting into investing, it's getting into medicine, it's getting into manufacturing, shipping, whatnot.
Correct.
So, what do you think it's creating an influence in medicine and surgery?
So AI definitely is getting into medicine these days, but I don't think AI is a threat to us. AI can make our lives easy by assisting us with certain things. Like we use a software right now where we just put a mic when we are conversing with the patient. When the patient comes to me, and when I'm talking to the patient and I'm taking the history, right? So in history we don't go by books when I'm sitting with a patient. So the topics are not always predefined कि ये इसके बाद यही topic आ गया, इसके बाद the patient can say random things, right? But it is up to me to summarize what all he has said. What it does is it exactly summarizes everything according to the book. So name, age, sex, profession, and current complaints, past history, previous surgeries, family history, everything it is going to summarize by the book, right? So, and it will not miss anything, right? And it has a capability to transcribe everything into medical language, right? So also very importantly, the AI should not be making spelling mistakes also, right? Because not a lot of not a lot of software will understand the spellings of what we write, and so all those things are coming up. So that has made my life easy because I don't have to now go through the pain of typing everything, and and I can go back and review the records whenever I want, right? So in that way, AI is helping me, but I don't think AI is ever going to replace the doctor. But are you going to trust that robot? And if suppose if you even trust the robot and something goes wrong, who is going to be accountable for it?
True.
Robot doesn't have emotions. Robot doesn't have accountability, right? Robot is a machine. You can, if you turn that off, there was nobody there, right? So ultimately, when we are dealing with human life, there has to be an accountability. People should be able to go back to the doctor and ask why you have done this. What was the rationale behind doing this surgery? What all care do we have to take now, and how long is it going to be to recover from this surgery? What all things he has to take care after the surgery? When do we come back to you for the follow-ups? You cannot talk to robot about such things.
True.
Right? And even if you talk to, like I said, if you turn that off, it's gone. Right? So the human being is going to be there until the human being dies. Right?
True.
So, but what about your field? Is AI taking over investing?
So it has already made its inroads into world of investing and finance as well. I think with investing there are two sort of primary activities any investment or investment advisor does.
Right.
So there is information gathering and analysis,
Right.
and then taking action basis that information which you have received and analyzed.
Right.
Now AI is surely helping in a big way in how you first collect data, information,
Right.
and go through it.
Right.
So like if I have to go through a company's annual report which is 500 pages, it will take me
Yeah.
fair bit of time.
Correct. Correct.
If I upload it to ChatGPT or Perplexity,
Yeah.
it will give me a one-page summary.
Correct.
So which helps me in gaining some critical data which I need.
Right.
This is what prompts I have given.
Right.
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 So
right.
I have got that gist. Now,
Right.
how do I use it? That's where the human intelligence comes in.
Okay.
Because data is something which you can present the way you want.
Right.
Means you can hide a few things and you can show few,
Correct.
or the other way around.
Correct.
Now, how to use that data is where the human, I think, edge is.
Right.
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 As far as execution is concerned, investing is driven by two broad thoughts of greed and fear.
Right.
Right.
Right. Right.
AI doesn't have greed or fear.
Right. Right.
Right.
It doesn't understand.
In an ideal world,
Right.
there will be no fluctuations then, because
Correct.
if everything is driven by AI, then people will not sell out of panic.
Correct.
And then people will not buy out of euphoria.
Euphoria.
Right.
Right.
Now, again, it doesn't happen in the real world.
Real world. Right.
Now, that's where the role of an advisor comes in play.
Right.
It is possible that market say are in some panic due to an event happening.
Right.
Maybe it's because of a war, or probably a
Right.
pandemic,
Right.
or something else.
Right.
Right. While the AI or AI-led model says that you should buy, but as an investor, you may not be willing to buy at all. Right.
Correct.
Now that's where that human angle comes in play, where you can explain that why, while it looks panicky, it is an opportunity to buy.
Correct.
Now that connection can never happen between a human and a machine.
Right. Right.
So a robo advisory app can give you that notification ki buy, but you may still not get probably acted just because of that notification, because
Right.
an app has suggested.
Correct. Correct.
If a personal advisor to you suggests that, there are good chances that after understanding the rationale, as
Right.
you said,
Right. Right.
you probably will feel that it's worth acting upon.
Correct.
The world of investing and personal finance is more about personal, less about finance. So it's more about how we behave.
Right.
Now, behavioral science is something which a human only can bring into a conversation, and not a machine today. 10, 20, 30 years down the line, if machines develop their own intelligence.
Correct.
Because as of now, that intelligence is purely data which has been fed to them. Right.
Right.
If they upgrade or graduate to that level, we'll see.
Right.
But for time being, it's unlikely that human advisors will replace or will be replaced by
the
AI or robo advisory or technology.
Right. Also, again, what you said earlier, like you see the entire profile of the client who comes to you, and you stratify the risks and opportunities for that particular client. I don't. Do you think AI will be able to do the
See,
entire
so
360-degree assessment?
again, there are two aspects
Right.
to it. So you can ask 10 preset questions which has predefined answers,
Right.
and can come to an output which gives you a risk profile, whether it's conservative or moderate or aggressive.
Right.
AI can do that because
Ah.
you are just probably asking someone to pick those options and put an outcome basis those
Correct.
answers given.
Correct.
Humans are not always driven like that.
Correct.
So in rare cases, but I may have a prospect who is 70-year-old, where according to the standard set of questions, the output would be that he should be into moderate or conservative risk profile.
Right.
But there are people who are willing to take risks.
Risks.
That okay, I have enough wealth,
Right. So
I am
risk
taken
too
care
much.
of, but I want to take this risk
This
because I understand this is a very minuscule part of my overall net worth.
Overall net worth.
Now,
Right.
AI may or may not be able to override those kind of specific
Right.
situations.
Right. Right. Right.
It's also driven by decision making, which is based on certain parameters and criteria. And as soon as you go beyond that or you deviate from that, it just flummoxed. It doesn't know what it should do. So
Right.
at times you have to take kind of tactical decisions also, which otherwise you would not take. But at that time, the situation warrants for it, and you can deviate from those parameters.
Right.
Now, at this juncture, because of these factors, it's looking less likely that AI or technology will be able to replace
Humans.
angle
Correct.
to
Correct.
the investment advisory.
Correct. Correct. Agree. So I think both of us are pretty safe. So as far as our lives are concerned.
Yeah. And in case of so you're talking about use of AI in your case, your profession.
Right.
At least many people like me who are not able to understand doctors' handwriting, they'll be able to see what's written on the
what's AI
prescription.
typing. Right. So wow, what a conversation it was, and you really surprised me with the parallels that you drew between how investing and practice of medicine or surgery are similar, but again not so similar.
Absolutely, yeah.
Because of one part.
No, that one is meaningfully, I think,
correct.
different.
But the similarities that you drew was, I never had the idea that it was so connected, or thought of it in a similar way. And again, I am very happy to hear that AI is still never going to replace you.
Neither you. So.
Right.
No, I think I also got enlightened after talking to you over these 15-20 minutes. I think there are some learnings which I can take home after this conversation.
Same here.
I think the kind of systematic planning you have to go through before the actual procedure,
correct,
I think puts a lot of emphasis on being fully prepared,
correct,
well aware of the situation,
correct,
willing to take a decision. I think while we practice it up to a certain extent, but as you said, there is always some room to improve or get better. I think
right. In our case, there is no there's no room for an error.
Exactly.
Right? Because one error is going to cost the patients their lives. Right.
Second, I think the willingness to take a difficult decision when the situation warrants. Is a superb learning, and I'm sure I can visualize a few situations where I think I can take, I should be taking difficult situations or difficult decisions which are in interest of a client's portfolio.
Correct.
Super.
Thank you. So we should do this again.
Yeah, let's do it again, man.
Yeah, it was great.
Great.
Thanks.
Thank you.